Okay. So now the next, that is the we till now we have discussed till now we have discussed about the normal value of the normal range of temperature. Now what is the abnormality? That is, there may be the hyperthermia or the hypothermia. Okay. So what is hyperthermia? When the temperature increases more than 99 degree Fahrenheit, that is the hyperthermia. And what is hypothermia? When the temperature decreases above the normal, then it is the hypothermia. And hypothermia is more common in children, or in neonate it is more common in neonate, and it may cause the hypoglycemia also. So hypothermia, that is the fever or pyrexia, we can say it. So there is a question that's the question number 7. A type of fever in which after every 24 hours the body temperature comes to normal level. It is known as which type of fever? Intermittent fever, remittent, continue or relapsing. What is that fever is called? That is the intermittent fever. In intermittent fever, the body temperature, the fever continue, but the temperature falls to normal. The example of intermittent fever is seen in that malaria. In malaria, kala jor, in that case, the intermittent fever is seen. Okay. Now the remittent fever. Remittent fever, when the body temperature continue and there is a peak of temperature and the slowing, the falls of temperature, but it never come to the, there is a peak and there is a fall but never come to the normal, never reach the normal, again peak again fall, but never reach the normal, কখনোই নর্মালে আসবে না. It is seen in the typhoid, that is the remittent fever. Then continue fever means the fever continue for a sustain. And the relapsing fever means the temperature comes after few days or after few week, the temperature again come. Okay. Now the next question, there is a, already we discussed the sustained fever, and there always remember this diagram, like variation of temperature less than zero point 0.3 degrees Celsius per day means there will be the increase of temperature and there will be decrease of temperature, but not less more than 0.3. Then example in the viral infection in lobar pneumonia in these cases. Intermittent fever we already discussed in malaria, kala jor, in this. Then relapsing fever, period of fever lasting day followed by a febrile period lasting the same duration. The always remember the example of this. কোন কোন কেসগুলোতে আমরা relapsing fever দেখতে, remittent fever, the typhoid fever is the example of remittent fever. This is a very important question. Okay. So what is this graph? There is a peak of temperature or high and again decrease, but it never come to normal, never reach to the normal. So it is the remittent type of fever, and remittent type of fever is seen in typhoid. And TB তে কোন টাইপের ফিভার দেখতে পাওয়া যায়? লো গ্রেড ফিভার. Okay, in TB the low grade fever is seen. Low grade fever is seen in malaria, that is the intermittent fever, typhoid remittent fever, and in viral disease we see the, in viral disease এর ক্ষেত্রে আমরা কোন ফিভারটা দেখতে পাবো? The step ladder fever means the temperature decreases in a zigzag manner. And what it is called? In fever we have to know the two term, that is crisis and lysis. So what is crisis? When the temperature decreases from a sudden high temperature, the temperature falls to normal, that is crisis, and it is seen in the bacterial endocarditis. Bacterial endocarditis. And in lysis, the temperature decrease in a zigzag manner before reaching to the normal. It is seen, the lysis is seen in the viral infection or viral diseases. Okay. The next question. A patient come to the emergency department. The assessment findings are increased body temperature, hot, dry, erythemic skin, no visible perspiration. Pulse rate is rapidly increasing and then slow down as the blood pressure fall. The patient complain of dry mouth, nausea, vomiting, etc. Identify the possible cause on the basis of assessment. So, what are the finding? Body temperature means hypothermia. হট ড্রাই এরিথমিক স্কিন মানে স্কিনে লাল লাল ছোপ হয়েছে এরিথমিক অ্যান্ড নো ভিজিবল পার্সপিরেশন দেয়ার ইজ নো সোয়েটিং ইন দ্যাট ওকে then the pulse rate is rapidly increasing and then slow down as the blood pressure fall. So what is the type of fever or what is this? This is an, tell me, heat stroke always, as there is no perspiration and there is the increased body temperature, no perspiration, and pulse rate change hocche and the blood pressure is also changing. The dry mouth, nausea, vomiting, all these symptoms are the symptom of the heat stroke. Then what is the difference between the heat exhaustion? In heat exhaustion, there will be diaphoresis, means there will be the excessive sweating. Clear? So what will be the difference? In heat stroke, there is no perspiration or no sweating, but in heat exertion, there will be the excessive sweating or diaphoresis will occur. And other symptom, the temperature increase, then the pulse rate will be rapidly increasing, all may be same or may not, but the change that is that there is a diaphoresis in heat exhaustion and in heat stroke there is no perspiration. So this is the main change, main difference. Okay, so up to this, do you have any doubt? So next day we will discuss about the pulse, the abnormality of pulse, or the what are the various condition in which cases the abnormality occur, in details we will discuss. Okay, so thank you everyone.